I'm joined by Patrick Kelly, the Executive Vice President of Government Affairs for the Healthcare Distribution Alliance. Patrick, thank you for joining me.
Pleasure to be with you this afternoon, Brian.
Well, listen, you and your industry are doing very important work these days, and I'm thrilled to have you here to talk to me about what's going on with vaccine distribution and sort of the state of the industry and the players. There's so much happening. Let's start with really what is the big news of the last couple of weeks, which is Johnson & Johnson's single-shot vaccine being brought to market, and frankly, the bombshell that Merck has decided to agree to join in and help produce that. So what does this mean? You know, the single shot vaccine now coming to market, what does that mean as far as the distribution of vaccines across the country and to New Jersey? Tell me a little bit about that.
Well, I mean, it's a couple things and a couple fronts there. Obviously, it means that we have a third vaccine now available for people to get access to, which significantly increases the supply of vaccines, which has been a problem.
Yeah.
The fact that the JNJ vaccine is a single dose, the fact that it does not require ultra cold chain handling, which is a complicating factor for the Moderna and Pfizer vaccines,
right,
makes it much easier to handle, makes it much easier to store. You can store it in your refrigerator at your house. I think will significantly increase the capacity of states and cities and localities all across this country to get more shots in arms. So ultimately, I think I'm not going to call it a game changer. It is a definite game enhancer.
Now, look, I don't want to oversimplify this, but is it correct to say, you know, the vaccine makers, the Johnson & Johnson and Moderna, that they're experts at that. And you know what? FedEx and UPS are experts at getting the package and the product to the door, but that the wholesale distributors are an important chain in between, that they're the experts at that collation and that organization in the middle. Is that too oversimplifying?
No, I think it's absolutely accurate. And again, the extenuating circumstance here is the fact that we have a national emergency.
Yeah.
We have a limited supply of product. The government owns all of the product, and the government is decreeing where the product is shipped. That's the non-standard aspect of this. But in normal business, absolutely, the distributors play an integral role. If the distributor weren't there, for instance, that pharmacy down the street from your mom's house would have to call 500 different manufacturers and say, I need 10 of these from your company and I need it tomorrow. That would never happen, because that manufacturer would be besieged by 185,000 calls a day. So the wholesale distributor is able to take the entire inventory of product of all manufacturers. And when that pharmacy calls their wholesaler, they say, I need, again, back to my earlier example, I need 10 Merck product, 10 Johnson & Johnson product, 10 AstraZeneca product, et cetera. And it is there the next day because we have the warehouses that keep all of that stuff ready and available for next day fulfillment everywhere around the country.
The wholesale distributors must be bringing their experience and their lessons to this moment, even though it's different. How does that come together? You know, what does that specific expertise look like?
Well, and again, during the normal course of business, we maintain relationships with every single point of administration, every hospital, every pharmacy, every doctor's office around the country. We have relationships with them. They trust us. They know that they can call us literally the day before and get a product the next day. So we have that relationship, and we are a partner of theirs, literally a partner of theirs. The fact that we right now have a central distribution model, a lot of our companies that are not the central distributor, in this case McKesson, are working with their customers that are receiving these products now through the federal system. But they're working to say, listen, I've got too much product. I don't have enough dry ice for the Pfizer product. Can you get me dry ice? Can you store it in your facility?
Right.
While we find the patients to administer it, or while we schedule the patients in. So they're assisting in other ways and helping out state governments, local governments, some of their larger hospital customers. They're fulfilling some of that ancillary support mechanism for those customers. And that's the relationship that they have and they will maintain.
You see, that's perfect, because when I try to simplify to understand what's going on, I forget about these details. There are these complexities that the wholesale distributors have baked in, that capability. So thank you for that answer. It's exactly what I wanted to know. Tell me how wholesale distributors are really put into action on a state basis, on a state level?
Well, and again, Brian, in this instance, because of the central distribution network, the distribution portion is relatively straightforward. You make it, the state government, state health department makes a call. They order the product from the federal government. The federal government then sends the order material to McKesson, who then says, okay, we're going to kit 78,000 vaccines for New Jersey, delivery on Thursday or Friday. They arrive at the point of shipment, whether it's in Newark or it's down in Philadelphia for southern New Jersey. Then the state will basically receive the product. The state will then parse it out to the various hospitals that they are going to, or mass vaccination centers. That's going to be the state logistics capacity. The state can enlist our other members who are not the central distributors in assisting with that parsing out, or they can assist enlist the military or the National Guard. It's the administration side of this that is it is the biggest challenge right now for the states, is getting the physical shots in arms. And then in the instance you just indicated, you've already received one vaccine. So I know you've got either a Pfizer or Moderna vaccine. We won't talk about that. But the logistics of capturing which patient gets which vaccine, and then for the subsequent booster that's going to be required for either the Pfizer or Moderna gets back to the same facility or a different facility to receive the same vaccine the following 21 days or 28 days, depending on which vaccine you got. That is a huge data kind of interface challenge that is really, I think it's the main reason why we see the significant delta between the amount of vaccines delivered and the amount of vaccines administered. We heard a state and territorial health official on a call 2 weeks ago describe the fact at one of their vaccination centers, they were, for every chair they had available, they were administering 2 to 3 vaccines per minute in a mass vax facility. They were taking between 3 and 5 minutes per vaccinated patient to capture the data and upload it to the system that will allow the state to then report the vaccinations and order subsequent vaccinations. So there's this lag in the capacity to shots in arms and then capture the data. And that's the thing, what's slowing down the administration process. Distribution is working just fine. And literally our members who are handling this product, saying they are 24 turnaround. From the point they get it from the manufacturer, within 24 hours, that entire inventory is out the door on its way to its point of destination.
Wow. Experts doing their jobs. Amazing.
Exactly.
Wow. Just the last point on this, I assume that as J&J comes online now with the lessened cold temperature issue, now we're going to be talking about more availability. And so we're talking about pharmacies and wider resources for people to get shots in arms. Using the model you just described, I would imagine the distribution chain can really just ramp up to meet that. As the end point gets more efficient, the distributors can just be right there to support it forward. Is that accurate?
Absolutely accurate. And I think, and again, that's the hope, is that we can literally, so we can make it as easy as possible to get these vaccines, whichever vaccine you're willing to get or you're able to get them as close to the people that need them as possible. And if that's the corner pharmacy, if that's the hospital, if that's the giant stadium, wherever it is, get those people there, get those vaccines delivered, and get those shots in arm, and let's head towards recovery and that backyard picnic with a cold beverage, get the cold beverages out of that Yeti cooler.
Patrick Kelly from the Healthcare Distribution Alliance. You're doing important work over there with your industry colleagues, and I thank you for joining me here on TAPintoTV.
Pleasure to be with you, Brian.